For example, yoga has been known to stimulate stem cell activity. Restorative sleep stimulates stem cell activity. Hormesis, like fasting, high intensity exercise, Finnish sauna, cold plunge, all stimulate stem cell release. There are certain foods and supplements known to do the same as well.
Welcome to the Radical Health Rebel podcast. I'm your host, Lee Brandon. This work started for me several decades ago when I started to see the impact I could make on people, helping them to identify the root cause of their health problems that no doctor could figure out, including serious back, knee, shoulder and neck injuries, acne and eczema issues, severe gut health problems, even helping couples get pregnant after several IVF treatments had failed. And it really moves me to be able to help people in this way. And that is why I do what I do and why we have this show. Welcome to this week's episode. And today I have an incredibly insightful conversation lined up for you. Joining me is the esteemed Dr. Jeff Gross, a neurosurgeon who has treated thousands of patients with neurosurgical problems and injuries with many years of clinical experience. In this episode, I was particularly excited to delve into the topic of regenerative medicine and its application in healing lower back pain. Dr. Gross shared his expertise on treatments for lumbar disc injuries, a subject that is of great importance given how prevalent lower back pain is in today's society. As someone who is passionate about helping people overcome lower back pain, this episode was a personal favourite. I gained a lot of new insights, and I'm sure you will too. Stay tuned to the full episode and join us in this fascinating discussion. Jeff Gross, welcome to the Radical Health Rebel podcast. Thanks for coming on the show.
Thank you so much for having me. It's my pleasure.
Yeah, it's great to have you on, Jeff. And as we were saying before I pressed the record button, it's a subject that people have spoken to me about it a few times, or asked me questions about it a few times over the last year or so. And it's an area that I just haven't had time to dig into myself. So it's really great to have you on the show. And as I was saying to you before, it's going to be educational for me. So I'm pretty sure it's going to be educational for the audience as well. So to kick things off, could you share your rather extensive academic and professional background and what led you to become interested in regenerative medicine?
Well, I don't want to bore everyone with my, background in academics, but, I have an undergraduate degree from UC Berkeley in biochemistry and molecular biology. I went straight to medical school at the George Washington University. I did 7 years of postgraduate training called the internship and residency. First year was in general surgery, followed by 5 years of neurological surgery, and 1 year was a fellowship in spinal biomechanics, the surgery of spinal biomechanics. And I've been in practice for 26 years recently in practicing neurosurgery. But it was at the urging of my patients 8 to 10 years ago that I started to get restless. I started to get restless attending the annual neurosurgery meetings that we go to for our continuing education and networking and what have you, where I was noticing that we were hearing lectures about the same treatments, the same surgeries, the same everything that I had trained to do 20 some years earlier by professors who were trained to do the same thing 20 some years before that. So I noticed that things weren't changing despite all the things I'm reading in technological fields of nanoparticles and advancements in immune science and all kinds of things. So my patients would come in not wanting necessarily to have surgery, and I'd try to help them avoid that. And they would say, well, how about this treatment? How about lasers? How about this? How about stem cells? And finally, I said, well, you know what? I have a background in molecular biology. I wonder what's happened in stem cells in these decades since I learned about it. So instead of going to the annual, spine surgery and neurosurgery meetings, I started going to regenerative medicine seminars and training. And I got retrained and educated to add that as a tool to what I offered patients. And it's blossomed so rapidly that now I'm almost full-time practicing in the field of regenerative medicine, aka stem cell medicine.
Mm. Yeah, it's interesting because, obviously I've probably over the last, what has it been, 23 years, I've worked with lots of different types of clients, but probably the most common type of client I've worked with is been people with lower back pain. And most of those have been people with disc derangements of some sort or another. So it's quite interesting that we're kind of in the same field, but we approach it from a different direction. So again, I'm kind of really, really, really looking forward to talking about this further. So you've mentioned regenerative medicine. Can you maybe explain a little bit more about what that actually is and why you believe that we should perhaps transition from traditional treatments to regenerative medicine?
Well, I think that first, as just a basic understanding, regenerative medicine taps back into our own body's innate ability to help repair and maintain itself. It's the same system that created us in the first place, from an embryo through a fetus, through a neonate, and then a young person, and then maintains us when we're adults. But it loses that ability. So what we're doing is tapping back into the actual biology, the cellular biology that can help repair us, especially when our repair system's not as great as it once was. So that's kind of just the flatline basics of it. There's much more to it. I hope we get into. But this, I don't know that we would transition to this. I think what we should do is make sure it's an option when looking at all possible options to address a problem. Making sort of the more artificial treatments like pharmaceuticals and surgery the later treatments down the scale.
Yeah. Yeah. I mean, again, from my point of view, so I work, well, I would call it in a holistic manner. So I try to look at things from multiple different angles. If someone's got a problem with the spine, I'm looking at their biomechanics, I'm looking at their posture, but I'm looking at their nutrition. Is there any muscles that are being inhibited because they've got organs that are inflamed? Is there a mental emotional aspect to it? So for me, the more tools in the toolbox we have to help these people, the better. So my view has always been, let's try and do it as natural as possible. And then if we run out of ideas in that respect, then maybe look at something else. And it's interesting because I have a client at the moment, he's not a spring chicken anymore, but he does have degenerative disc issues at the moment. And he has been to see an orthopedic surgeon, and I don't know exactly what technique he's used, but the way my client has described it to me is that the orthopedic surgeon has injected concrete-like substance into the disc area. I don't know if you're familiar with what that is. I actually don't know what that is.
Not specifically in this case,
right.
No.
Okay. But it sounds to me like, I had to look at your website. It sounds to me like, stem cell therapy could be an option for someone like him. Because I can give someone the best exercise program in the world. I can give them the best diet to follow in the world. I can give them the best sleep plan to follow. But if they've got to that point, there's probably only so far that kind of program is going to take them, right? So
agreed.
So I think it's really important, whichever angle you're coming from, is that we can look from as many different angles as possible to try and help people. That's my philosophy.
I carry the same philosophy. And in fact, when we offer someone a regenerative stem cell based option, we want them optimized so they get the most out of it. And that is a more holistic optimization. And we offer, all the things that you would recommend, because if they're not sleeping right and their nutrition and supplementation is not right, and they haven't done the work in the exercise realm, and they're not doing the breath work and the mindfulness, their body is least receptive for that regenerative approach. We want them to really, really get the most out of it. So it's not just, hey, here are some stem cells, this will fix you.
Yeah. The other thing I'm kind of thinking at the moment, someone listening to this, they might be saying, you've mentioned stem cells a few times, but I'm not sure what stem cells actually are. Could you maybe fill in what stem cells actually are?
Yes, I'm glad you brought that up, because when I use the phrase regenerative medicine, stem cells is more the sexy part of that phrase.
Mm.
Because regenerative medicine comes these days in many forms. The three basic forms would be PRP, which is called platelet-rich plasma,
Mm-hmm.
and we can explain this to the extent you like. Stem cells themselves, and now even further, stem cell derived signaling, or what we call extracellular vesicles, or exosomes for short.
Mm. Interesting. So, what would you, if you were to define what stem cells actually are, what would you give as the definition?
So, stem cells is the general phrase of the type of cell that has not fully been assigned a job or tissue type in your body yet. And there are different levels of potency of these cells. For example, when you're an embryo, those cells that are dividing in the very early stages, they can become anything. They're omnipotent. Then, after time, they're influenced and by cell signaling factors to, let's say, become part of the limb, but the limb hasn't developed yet. So those aren't omnipotent; they're pluripotent. They're still amazing. And then they work down a channel until it finally becomes, sort of a more basic, typical stem cell that we call a multipotent stem cell. So it can still become many tissue types, but it's not going to create a new person. So it loses power. But once we're done growing, we maintain these in our body to help us repair, heal, maintain, restore, and regenerate. But like any human, we're exposed to our world, and our world contains questionable things in our water supply, questionable things in our soil and in our foods, questionable things in our meats if you're a carnivore, questionable things in our air, questionable stresses, and all these, we'll call them pro-inflammatory or pro-oxidant problems that our cells are so busy defending against, that our cells become less functional and inflamed and degenerated. And this is where we get what's called aging, biological aging, right? It's accumulation of chronic inflammation at the cellular level. And you could see it in the outward appearance of someone, looking at their skin or hair, what have you, or you can also see it internally by looking at cell markers. So our stem cells as adults can be affected by those same processes and become less efficient at healing and not be able to repair us. And that's when we start to get into problems and diseases like degenerated discs and joints, and loss of elasticity in skin, or leaky gut problems, or and other inflammatory problems. We could make a long list. So the entire basis of regenerative medicine is tapping back into the ability to use that system advantageously to help reverse that cellular inflammation and foster restoration, healing, and repair.
Yeah, interesting. So the first thing you mentioned was PRP. Now, I remember reading an article in a journal about, I'm guessing, 5 to 6 years ago. And at the time, they were saying that it had about a 50% success rate. And I can't remember there was a specific type of injury the paper was looking at. I think it was something to do with the knee. I think it was some kind of knee injury. Can't remember the exact one. And they were saying that it had about a 50% success rate. Is PRP something you use, or is it something you don't use?
There's nothing wrong with PRP. It is an amazing appetizer into regenerative medicine. It's low cost, low level, and has some efficacy. I don't use it personally because when I jumped into this, I wanted to get all the best practices and put them together and just go right for the win for these people. But that's not me knocking PRP in any way. Many doctors use PRP successfully. The downside to PRP is you do have to draw your own blood. So you're dependent upon the health of your body and the age of your body and your cells. And you have to usually do it 2 to 3 times. And it's mostly used for tendonitis, like a tennis elbow, golfer's elbow, things like this. For more robust regeneration, it's probably not as strong. It's the least potent regenerative we have.
Yeah, interesting. Okay, so that kind of makes sense in terms of what I read in that paper at the time. So I guess the next question I have in my mind right now is how do you do stem cell therapy? Catherine had always been fit and active when she suffered a debilitating back injury. She was barely able to get out of bed or walk without being in excruciating pain. She visited her GP, who prescribed anti-inflammatories, painkillers, and muscle relaxants, and also referred her to an orthopedic consultant. Catherine was bedridden for 10 days and subsequently could only get through the day with large doses of the prescribed pills. Catherine was diagnosed with a prolapse disc at L3-4, and she was offered anaesthetic injections or spinal surgery. She was horrified and concerned that she would have constant back problems for the rest of her life. Catherine was miserable, could hardly drive, a day at work was agony, and any movements in bed were very painful. I carried out detailed postural assessments, muscle strength tests, and analysis of her movement patterns. I identified the biomechanical problems and prescribed a very specific exercise program to correct her posture, reduce her level of pain, and to prevent the injury reoccurring. After 5 weeks on the program, the pain had reduced hugely in her back, and Catherine stopped taking painkillers. After 10 weeks, Catherine was back jogging and doing more intensive exercise with absolutely no back pain, and she was so pleased that she was able to pick up her young son again. If you're suffering like Catherine was, and you'd like to find out more about getting to the root cause of your back pain, go to www.bodycheck.co.uk and request a consultation. Now, back to the podcast.
Well, as I mentioned earlier, the next 2 levels of regenerative biologics would be stem cells and stem cell signals called extracellular vesicles. Mostly what we do now is extracellular vesicles for this reason. Stem cells, if you have them delivered to your body, let's say you have an IV stem cells for various reasons, those stem cells will probably last in your body 10 to 14 days, if that. Yet the benefits go on for weeks and months thereafter. So why is that, right? And this has been studied, and it is clear that the stem cell delivery to your body is actually causing cell communication to your cells, helping to slow the inflammation, activate your stem cells and your cells to function more youthfully. And that signal is through these small communication bubbles called extracellular vesicles. Now, cells themselves are small, but these extracellular vesicles are 1,000 times smaller. So we call them nanoparticles sometimes, but for short, we call them exosomes. And exosomes have many advantages over stem cells, and really, they are doing the work that stem cells would be doing anyway. So we've skipped now over stem cells and go right to, in many cases, these exosomes. That doesn't mean there's anything wrong with stem cells. And they're used successfully, throughout the world. But I'm skipping over the delivery mechanism, going right to the business end of regenerative medicine. And when I entered regenerative medicine, when I made that early transition, I wanted to pick the most efficient source. So the beauty of these exosomes we call them exosomes for short. They're stem cell derived exosomes. But the beauty of them is they're abundant. They travel very well in the body. For example, they cross the blood-brain barrier into the nervous system if they're given IV, where stem cells really don't. They're too large. They're much less costly than stem cells, less than half the price for the same kind of effective dose. And we can give even more concentrated doses because the main source is from donated amniotic fluid.
Right. Interesting. I was going to ask that question. Where did the stem cells come from? That was going to be my next question. Okay, that's really interesting. So how do you get the donors for the amniotic fluid?
Well, I don't directly. I purchase these from reputable labs, and they're all over the world. I use them from here in the States. There are certified labs where they go through an approved donor process. They sign up women in the first trimester, and they screen them and test them, make sure they're healthy, they're not smoking, drinking, doing crazy things. They make sure they don't have diseases. They take their prenatal vitamins and what have you. And then through an ethical process at the time of an elective C-section birth, congratulations, here's your baby. Thank you for your amniotic fluid that you would have just thrown away anyway, right? And then that goes to the lab where it's tested again and screened. These are, incidentally, people who have not been vaccinated for COVID.
Mm-hmm.
And although that could be a political statement, it's not meant to be here. It's because we just don't know. We just don't have enough time and knowledge to know. And we're starting to learn things all the time about that. So we want to be extra cautious. So that's why we select those. So I'm not involved in that process. I simply procure these from these labs who make them available.
Yeah, I was just curious as to where it would come from, and I'm glad to hear it's people that are donating rather than it's just taken from pregnant women. But so that's good to hear.
Yeah, super ethical.
Yeah, that sounds good. So the other thing you've mentioned is exosomes. Now, my only understanding of exosomes, in terms of I've read a number of books that have discussed exosomes. And up until speaking to you today, my understanding of exosomes is that there are particles that help remove toxins, or they are toxins being removed from cells. Is it the same kind of exosome, or are you talking about something different to that? Or have I got the understanding wrong?
I don't know what you've read, but exosomes are basically a small bubble off of a cell. All cells make exosomes. Even unhealthy cells put off an exosome signal, and that's an unhealthy signal that communicates with neighboring cells, because one cell sends out this bubble. The bubble contains certain growth factors, proteins, peptides, and microRNAs to influence what's going on in the factory of another cell. So if our cells are busy, in defense mode, chronic inflammation, fighting against the environment, dealing with pesticides and what have you, our cell signaling is going to be that signal to other cells. So they're all participating in that neighborhood watch program. And that's why we like to reprogram the cells, influence them, even on a temporary basis, into a more restorative mode through these healthy, naive, innocent, young stem cell derived exosomes. So all cells make them, and they influence what's going on in the cell. So as to carrying toxins, I suppose if you had a cell with toxins, it would send out toxic exosomes. If you had a cell that was busy helping cells fight against toxins or fight oxidants, more antioxidant behavior, then it would give that signal.
Gotcha. Yeah. I mean, I'm slightly going off subject a little bit here, but just to throw it out there, I know there are quite a group of an ever increasing group of doctors at the moment that are kind of saying what you think viruses are actually exosomes. But that's
in some ways that's true. Right. They are encapsulated information and cell signaling that influences what goes on in a cell. They are of sorts a non-human exosome. They hack the system.
Interesting. Very interesting.
Yeah.
So let's just imagine someone comes to you, and let's say they've got degenerative disc disease in their lumbar spine, let's say. And maybe they've been to see someone like myself, and they've looked at the exercise program, they're eating well, they're hydrating well, they're sleeping well, they're minimizing their they're doing all that stuff. What would the process be if someone came into your office like that? Can you talk us through what that would be like?
Sure. But if you would allow, I'd like to flip the paradigm in the nomenclature first. As we age and our cells aren't able to maintain us like they used to, we do degenerate. But that's not a disease. So we use these garbage, lazy phrases like, and it's not your fault. We see them everywhere. Degenerative disc disease or degenerative joint disease. I have disdain for those phrases. These aren't diseases. This This is an accumulation of inflammation. It's part of the aging process. To the extent aging is a disease, then perhaps those other degenerations can be called diseases. But I'd rather we speak specifically. Like if someone comes in and sees me and has pain in the lower back and a degenerated disc or two, that doesn't mean all 30 some discs in their entire spine is degenerated. They're not born with a disease.
Yeah.
They've accumulated a degeneration of an issue. So sorry, that's just me on my high horse for a moment, but I'll step off here. And so frankly, these days in the post-COVID world, and because my practice has become sort of national and even international, people meet with me this way by televideo, and we have them fill out a brief form and we start the dialogue. I make sure they're optimized. As you said in this example, they're already doing all their work they can do. They're doing their own rehabilitation, the right strengthening, core work. They're feeding their muscles, the right protein, the right macros, the supplements, the all the stretching, everything. But they're still having a problem. We first and foremost, we have to pin down the source of the problem, and usually the problem is pain. And we look usually at an MRI scan for if it's a joint or the spine, like in your example. And the MRI has to be a high quality MRI, not a cheap one. So it's this is called a 3 Tesla MRI. 3 Tesla is typically the highest quality signal to noise ratio. So if you were going to buy a new LCD screen for your home, you would go to the store. You would say, "Hey, what's the best one?" I say, "Oh, it's the 4K Ultra HD." Okay, that's the resolution I want when I'm looking at a picture, right? So we want that kind of MRI for someone. We do it with what's called inversion recovery sequence, which is an add-on that helps us identify the changes surrounding the cartilage, whether it's a disc or whether it's a joint, another joint in the body. We want to see the changes in the bone cells adjacent to that cartilage. And then we do what doctors are trained to do. It's called clinical correlation, where we take the symptoms and the test results, this MRI, and we try to match it up and see if we can best explain where all this is coming from. Now, of course, at some point we need to lay our hands on the patient and examine and poke and prod, and that's always a requirement. But we can do most of it remotely now, and in many cases that helps us. So, for example, it might be, in this disc example, we might find a specific disc in the lower back. Let's say the lumbar 4 to 5 disc. Maybe all the other ones don't look so bad. In some cases, we see changes in all the discs, but only one is hurting. We don't want to go messing around with the other ones that aren't hurting just because they're starting to show some age. So we have to identify the source of the pain. And sometimes we do an injection to numb or block the suspicious area to see if we can get a temporary benefit. Put a little Novocaine or lidocaine in there, which is a numbing agent. And if the patient has a day or two of significant benefit in the pain, even though that's not a long-term cure, at least we say, aha, we've now confirmed practically what we see on the MRI is the source of your problem. And once we confirm that, then we can formulate options, including a regenerative approach to addressing that, hopefully without surgery. Right? That's the goal.
Yeah. It's interesting when you said the word clinical correlation, because that's something that I think got left behind in the COVID era.
I think it was on its way out, especially here in the watered down, institutionally driven healthcare system that we've become in the U.S. So it's important that the doctor listens and spends time and examines and correlates. That's why we go to medical school, and it's been so long training. Learn how to do that. That's the art of medicine right there.
Yeah. I mean, it's crazy because I was trying to shout from the rooftops back then because, I run functional labs for my clients, and
good.
What's the first thing you learn? You don't treat a test result. You have to have clinical correlation, right? You can't treat a test result. But yeah, that's exactly what was going on. But that's a whole nother podcast.
Agreed.
So let's say, for instance, someone comes to you, you get the what was it, 3 Tesla MRI. I was going to ask you actually, why does it need to be such a high quality MRI?
Uh, because that is really what it takes in most cases to not miss what we're looking for, which is some type of addressable target in the bone cells that create and maintain the cartilage. And these bone cells are adjacent to the cartilage. We call it the subchondral bone, chondro being the Latin root for cartilage, sub being just under or just adjacent to. So we want to look for those, changes and degenerative changes in those bone cells, because cartilage itself is sort of a biological rubber. There are not many cells in cartilage. So we don't want to inject the cartilage. Although there are some benefits from that. The better benefits, and this is well proven, and there's wonderful literature to support it, French literature. But it's well proven that injecting the subchondral bone with regenerative biologics is quite superior in the long run to injecting the cartilage itself.
Interesting. Yeah, because when was it? 11 years ago, I actually herniated my L4-5 and I had quite a severe bulging of L5-S1, which is very typical of someone in their mid-40s, as I was at the time. And when I looked at the MRI, to me, it looked really clear. But I was just looking at the disc, right? Predominantly, and obviously the nerves that were being entrapped by the discs.
Right.
And, I obviously get clients coming to me with back problems, and they may have already had scans done, normally MRIs. And they always show them to me. And I say, well, look, to be honest, I mean, yeah, I could possibly look at some and I would know what I'm looking at, but most of them, I don't really know what I'm looking at. I'm not a radiographer. But show me the report and I can understand the report. And then quite often what I find is the way that reports are written, it's so that people can't understand what the hell they're just, right?
Well, it's much worse than that, but because they're so subjective and experience based. But go ahead. Sorry.
Yeah. So quite often I just have to translate to my clients what it says on the report, because obviously there's lots of Latin words and things like that on there that your average person's got absolutely no clue what they are. And there's a part of me that thinks that's actually done on purpose, but that's a whole nother discussion. But most MRIs that I see probably aren't the ones that you mentioned, the 3 Tesla or whatever it is. So that's quite interesting, and I guess it's refreshing to hear that you do need to look in so much detail so that you do know exactly what it is you need to treat, rather than it's a little bit muddy. You're not exactly quite sure, and let's try this, rather than we know it's definitely this, so let's treat that. So that sounds good.
Yeah.
So again, just as an example, so someone came in, let's say they've got disc degeneration. What might the treatment process be like for someone like that?
Well, let's, in this example, if we identified 1 or 2 discs and it was, confirmed that those were the sources of pain, and they had no other sources of pain, for example, a problem with one of the joints of the spine called the facet joints, and that there were no other discs of question, then we would offer as one option a regenerative injection of the subchondral bone surrounding that disc, meaning above and below that disc, or discs. So if there were 1 or 2. And that's a procedure we usually do at a little injection facility with some sedation. And it's usually a one-time deal. And I would offer the exosomes in those areas. And then, it takes a good, 8 months, give or take, before I would be looking for the type of regenerative benefits in a spine.
So is it kind of like the end plate in that example that would be injected?
You're right.
Okay.
So the cartilage end plate can't support the disc because the chondrocytes, the cells that make cartilage, become so degenerated. And that's the root of the degeneration. It's a metabolic bone problem. And people with back pain know this. If they're on a bad diet and they clean up their diet to an anti-inflammatory diet, some of them have improvement in pain. And this is exactly why. So we're addressing that same issue.
Yeah. And what's the kind of scientific evidence that's kind of supporting these approaches at the moment? I'm briefly interrupting this episode to remind you can now hear an extra No Punches Pulled episode every month with an amazing and almost certainly controversial guest who's not scared to put their head above the parapet. These guests are exposing lies and corruption, sharing their stories of being gaslit or cancelled for telling the truth, and offering real-world solutions to achieving optimal health and maintaining freedom amidst increasing censorship and restrictive regulations. These are the types of episodes I started producing back in 2022, for which I was cancelled on Facebook, Twitter, YouTube, and deplatformed from LinkedIn. These additional episodes are for subscribers only. For the equivalent of one takeaway coffee per month, you can now become a paid subscriber and receive exclusive access to content the authorities do not want you to hear. I really hope you can support the podcast to help it continue, and also to help me bring you even better, more controversial, educational, and inspiring guests. Subscribing to the Radical Health Rebel podcast is a much more productive investment than supporting organizations that feed you lies, propaganda, and predictive programming like TV licensing, cable, satellite, and major film streaming services. Subscribing to the Radical Health Rebel podcast to receive premium content couldn't be simpler. Just go to the show notes, click on support the show, and follow the instructions. In fact, why not do it right now? And once you've subscribed, come straight back and listen to the rest of the episode. For the equivalent of just one takeaway coffee per month, let's rebel against the mainstream narrative and create a healthier, fairer, and freer world together. Thanks for listening and for your support.
Well, I would direct you and your audience to probably the leader in this bone injection field, which is Philippe Hernegot from University of Paris East, who has published a few years ago a 15-year follow-up study in injecting the bone surrounding knees. So he's an orthopedic, so he's got access to knee patients. Knees are sort of the low-hanging fruit of regenerative medicine due to the way they biomechanically load. They have the earliest and best results, and that's my observation as well. We start to see results in knees from 4 to 6 months. And we have examples where we've done some MRIs after the fact. So we have a comparison, and we have shown increase in the thickness of the cartilage of the knee. Now, we haven't published this yet, but Dr. Hernegot, Professor Hernegot, has published, and he's the one who has well proven in a study where he did half the patients subchondral injection in the bone and half the patients in the cartilage. He's the one who proved that the subchondral bone injection is quite superior to the cartilage injection itself.
And would I be right in thinking that the injection will be done with X-ray?
Yeah, so even though before the procedure, we pre-plan the targets based on the MRI, then we go into the injection facility and use a fluoroscope, which is a video X-ray device, to know exactly where we're going. But it's a quick procedure. As I tell patients, most of the hard work is the visits and the correlation and the MRI targeting. The procedure is just sort of the final 100 yards, of a 5,000 kilometer race.
Yeah. That's interesting. Yeah, I was thinking more like, a lot of athletes, they say the hard work is done in the training, the actual competing is the easy bit. So that kind of sounded like something similar there. And
probably.
Why do you think that this kind of therapy isn't more popular than it actually is at the moment?
Well, it's new, right? And going with the theme of your podcast, it's radical, right? Respectfully radical, from the good definitions of radical, not the questionable ones. So it's new, and new things take a minute to be adopted. And by minute, I could mean years. There are regulatory pressures, at least here in the States, probably in the UK as well. There are also economic and political pressures because of companies that would suffer, like pharmaceutical companies and the companies that make implants for knee replacements or spine surgeries. They would suffer. That's a multi-billion-dollar industry. So they're going to slow this down because they have a fiduciary obligation to do so.
Yeah. And I guess the other thing possibly as well, because that's kind of where I've been coming from for a while, is that something new, you're just naturally skeptical, right?
Yeah.
And I think I've gone from being skeptical to inquisitive. And obviously, as there are more success stories, then more people will be more open to say, "Oh, yeah, I know someone's actually been and had that done, and it was very successful." Whereas, I've spoken to people that have had PRP, and I don't think I've spoken to anyone that actually said, "Yeah, I had a good result from it." They had lots of negatives, but no actual positive to it. So, I guess
Right.
the more success stories, the more it will increase and increase.
Right. PRP is very popular here in the States. And we do see a skewed population. So to be fair, if someone has PRP and they've done great, they're not someone who's going to present to me. So I won't meet them. So we only meet the people who are probably didn't work with, So that's just the nature of the beast, right? We're here to help people with problems. If they have no problem, they're not going to come see us.
Yeah. So sounds like what you're saying in the US, PRP is kind of like the first port of call for most people.
Generally speaking, I mean, if people come see me and they have not had PRP, I'll list it as an option. But when we compare all the potencies of the different biologics up through exosomes and the cost of one exosome delivery versus 3 PRP deliveries, we're almost on par cost-wise sometimes. So, people, if they're going to do this, they want to have the benefits and they want to have them in the shortest amount of time.
Interesting. So I did an episode a few months ago with a lady, and she's involved in these patches that you can put on your body. And the idea is it actually stimulates your own body to create its own stem cells. Are you familiar with that?
I've heard of these things, different brands, and people have asked me about them before. It's nothing we use in our practice, but there are many things one can do to stimulate stem cell activity. I don't think it'll create a stem cell,
right.
But for example, yoga has been known to stimulate stem cell activity. Restorative sleep stimulates stem cell activity. Hormesis, like fasting, high intensity exercise, Finnish sauna, cold plunge, all stimulate stem cell release. There are certain foods and supplements known to do the same as well. So if these patches would probably fall in that genre of sort of supplements, if you will.
Yeah. Yeah. I mean, I actually do know one person that has used them, and she said, yeah, they're amazing. So yeah, that's just one person. And yeah, I just didn't know if you had any specific experience of them.
No, I do not.
So what do you see coming in the future in terms of this kind of technology? 42-year-old Chris came to see me whilst training for his first marathon. Initially, Chris wanted manual therapy on his calf muscles, which were taking a pounding from his long runs. I did recommend to Chris several times that he really needed a full exercise, nutrition and lifestyle program so he could complete the marathon in the quickest time and to minimize his likelihood of injury. However, 6 weeks from his first race, Chris suffered a debilitating back injury that meant he was unable to walk and was devastated that all his hard work had gone down the drain. Chris hobbled into my treatment room the next day to see if we could salvage the situation. I suggested to Chris that he do what I recommended all along, and if he did, he'd probably have a 50% chance of completing the marathon. So I've gave Chris a full physical assessment and then devised a comprehensive exercise, nutrition and lifestyle program. And full credit to Chris, he gave it 100%, totally dedicating himself to the program. Days before the race, Chris came to see me for a final tune-up and to ask whether I thought he was ready for the race. I suggested he start the race, but to stop if he felt any back pain, as there will always be other races. I received a text message from Chris the afternoon of the race to say that he completed it in 3 hours, 42 minutes, and he had no pain and had little to no muscle soreness. Chris has since gone on to run multiple marathons in impressive times. So if you're suffering from back pain that's preventing you from doing something that you love, why not arrange a consultation with me at www.bodycheck.co.uk so I can show you what's causing the problem and how you can get back to performing at your best. Now, back to the podcast.
Well, what we're using right now are these generic MSC, which stands for mesenchymal stromal cell derived exosomes. So these are just basic stem cells, mostly for our structural tissues and organ tissues in the body. What I see are coming very soon will be tissue-specific exosomes. For example, neurologic tissue, neuroectoderm tissue, exosomes to help, even at an enhanced rate, help people with neurologic issues, spinal cord injuries, cognitive decline, dementias, Parkinson's, things like this. Regular exosomes help already, but they're helping the supportive cells to suppress the inflammation. We're looking to help the neurological tissue itself. And maybe even more exciting is we now have immune cell exosomes. I don't have them clinically available yet, but we will. And these exosomes are actually selectively able to find and kill cancer cells without harming normal cells. So they come from certain types of T cells in our immune system that are known to do this for us. But when a tumor grows and escapes the ability of a body to remove those errant cells, then we tap into regenerative medicine and try to help address the cancer that way. So that's coming very soon, and I'm very excited about that.
Interesting. I suppose the one thing, unfortunately, that's quite big in the world at the moment is damage from a certain experimental injection that you mentioned earlier. And that's having, neurological issues and, all sorts of, heart issues, cardiovascular issues. Do you see potential in that arena?
Yes, we already have seen that using the currently available stem cell derived exosomes, IV, for people with what we call long COVID and other inflammatory problems like autoimmune problems. Diseases of aging are generally diseases of inflammation. Cardiovascular disease has an inflammatory component. Alzheimer's dementia has an inflammatory component to the misfolded proteins. Osteoarthritis is probably the low-hanging fruit in that group, but we see people with all kinds of SIBO and mast cell activations and thyroiditis and inflammatory bowel problems, anything with an inflammatory component, because regenerative medicine is, in its essence, naturally and powerfully anti-inflammatory. And then also for people with the lung issues, in a post-COVID or chronic bronchitis setting, we can do the exosomes by a breathing treatment. And that's been very helpful.
Yeah, it sounds like exciting times. It sounds like there's so many potential benefits for people. When I've got people in my family with dementia and, I've got my parents' generation are all getting to that age where they're all starting to get rather severe inflammatory problems. But then also a lot of people of that generation have spent most of their lifetime eating terrible diets, not really exercising properly, not getting to bed on time, you know. So
agreed.
Not eating foods that are, beneficial to their gut microbiome, which again are linked to a lot of these conditions that you mentioned, as well as, inflammatory conditions.
Agreed.
But, it was great for me to hear you say at the beginning, I think people should be doing this first anyway, because it's going to enhance the treatment. And I think oftentimes a mistake that some people can make is think, well, I'll just skip all the exercise and the good diet and get into bed on time and the saunas and the cold plunges and the breath work. I'll forget all that. I'll just go and get an injection. That's the world we live in, right?
Right. It is. It's the immediate satisfaction world, instant delivery and, all the online apps and things. No, we still have to do it right. If you want the real benefits, you got to do the work.
Yeah. Yeah. It's interesting. So, as part of my training, I was taught the 6 foundation factors of health, which are positive thoughts, correct breathing, optimal hydration, optimal nutrition, good movement, and then sleep and rest. They're your non-negotiables. But I've always said, right, that's great. But I've had situations where I've had clients who they've got all that in place, but they're still not quite right. And then I've said, right, okay, so for those people, we might need to add on to that. So, for instance, electromagnetic radiation is one of those things that for some people, yeah, they could have all those 6 things in place.
Right.
But if they're being affected by electromagnetic radiation, like, maybe they're sleeping next to a Wi-Fi router or a smart meter. Well, smart's not really a good word for a smart meter, or whatever it might be, then, those 6 foundation factors, they're not going to get the job done because you've got to remove the electromagnetic radiation. Or it could be toxicity. That would be another thing, right? As an example. It could be that someone had a lot of antibiotics in earlier life, and it could be they've got an issue with their gut microbiome. So, for me, it could be that for some people, again, they've got everything in place, but they might have some kind of disc degeneration, or, they might have end plate fractures in their lumbar vertebrae. Yeah, get the 6 foundation factors in place. Make sure you're not near it, too much electromagnetic radiation. Make sure you haven't got too much toxins in your environment. And even if you haven't, you still might need to detox the ones that are in your cells as well. And then you still might need to come to someone like you to actually get the ultimate result that you want, which is to become pain-free and live a normal life again.
Yeah, I couldn't agree more. I think it's not just, here's a dose of stem cells, you'll be fine. You got to do the work. You got to avoid the harmful, pro-oxidant, pro-inflammatory forces out there in the world.
Mm. Yeah. What would, let's say someone came to you and perhaps they didn't have a good diet, they weren't exercising correctly, they didn't have good sleep habits. What would your take be? What kind of advice would you give to that person? Would it be a case of, look, we can do this, but it won't be as good a result than if you were taking care of all these things? Or would it be a case of, go away, I'm not even going to treat you. You need to come. You need to come back when you're ready. And I know every patient's different, but what would your kind of general view be on that?
It's in between. I'm not going to send anyone away. They'd probably need more help and love than someone who's already optimized. But
yeah.
So we start to chip away at their lifestyle problems, their epigenetics, and we do it in baby steps. So, okay, let's go to sleep a little earlier. Let's not eat after 6 p.m. Let's look at your macros. Let's look at your supplements we can add without going overboard at the beginning. Here are the 5 starter supplements. We take it in baby steps. Maybe we do some labs, some functional labs or other labs, other markers at the beginning. And maybe we repeat those 6 months after interventions have been, followed diligently. And we want people to see benefits, even if it is on a test for a minute, so they know they're doing the right thing for themselves.
Yeah.
But if they're suffering greatly, if you have a knee and they can't walk and they can't exercise, we may need to get to it sooner rather than later. So it might be a combination. Okay, we're going to do the treatment earlier than I'd normally like to do it, because if it starts to help you, then you can get even more work on your exercise, your movement, that kind of thing.
Yeah. I mean, the other area that I kind of see potentially great benefit and probably a bigger market would be, kind of elite level sport. Would you agree with that?
Yeah. I mean, we have athletes, professional athletes, that come to us in the off season, and we help them in various ways. They like to keep this under the radar, because they don't want their employers knowing they have small issues, since their payment is sometimes dependent upon their health or their apparent health or their perceived health.
Yeah. Awesome. So what's next for you, Jeff? What's down the pipeline for you in particular?
I'm very passionate about these immune exosomes, trying to get them in our hands and offer them to people as an adjunct to helping them address and heal from cancer, maybe prevent. We'll be looking at those very closely, and enhancing what we do diagnostically. We're always trying to improve the ease of figuring out the targets. So tweaking. There are new types of MRIs. We talked about 3 Tesla MRI. Some people are using 1.5 Tesla MRI, which is the one below that, which incidentally is not twice as good. A 3 Tesla is not twice as good as a 1.5, because 1.5 Tesla is the magnetic field strength, how much magnetic power is in that. And that the power varies by the square. If we can do a little math here. So it's much greater than 2 times.
Right.
There are some new artificial intelligent approaches to a 1.5 to enhance the images to make them as good as a 3T. So we're looking at that. And there are 7 T magnets, we call them magnets, MRI machines in the world. They're just not clinically available. They're at certain academic centers and factories. So I'd like to see some of those out in the market. It's really going to help us do what we do.
So, Jeff, are you telling me that mRNA injections aren't the savior for everything?
I am saying that we don't know enough. We're curiously worried about mRNA injections, and I'm talking to you from Las Vegas, Nevada, and we have a saying here: we don't want to find ourselves buried in the desert.
Yeah.
So, because we're here in the desert. You might have a different phrase in the UK, but you're dumped into the Thames or something. I don't know. But be that as it may, interestingly, exosomes are natural delivery of growth factors and peptides, and that's a big area we're looking at as well. And mRNA, natural mRNA that the body makes to encourage local cells to behave as a group.
Interesting. Yeah, I mean, peptides is the other thing that I'm hearing people asking me questions about as well at the moment. It's been peptides, and again, it's one of those things I just haven't got round to looking at.
Yeah, I'll just to whet your appetite and your audience's appetite on peptides. Our body makes proteins. We ingest proteins, we break them down into amino acids. Sometimes we have protein powder that's just the amino acids, but we reformulate those or reconstitute those into proteins we want or need based on cellular instructions. And exosomes influence the instructions in different cells. So we need those, but the smallest fragments, usually 20 amino acids and less, are typically known as peptide fragments or peptides. And peptides are all around us. For example, Ozempic or semaglutide, which is the GLP-1 agonist, is a peptide. Insulin is a protein or a peptide. Endorphins, if people hear the word endorphins, you exercise, you feel happy, that's a peptide. Melatonin is a peptide and a wonderful supplement. And all these things are natural to us. Well, there are others, and now they're becoming better understood and able to be used to hack the system or biohack into different types of health desires. Most of these are injectable, though, so it takes some effort, and typically daily injectable. But for example, if you're healing, there's something called the Wolverine protocol, which is BPC 157, which is body protection compound 157, TB 500, which is another peptide, and some GHKCU. So all these fancy terms are peptides that you can obtain on your own by ordering them online. There may be regulations in certain countries. I certainly don't know all of them, and you can inject them and enhance your body's healing. Some of them stimulate the release of growth hormone, and growth hormone sounds scary. Well, I don't want to grow anymore. I'm an adult, but it's kind of a misnamed hormone. It's really the anti-inflammatory hormone. Should call it the anti-aging hormone. Yeah.
Yeah, that's very interesting. Where can people find you online, Jeff?
We've rebranded our practice here. It's called Recelebrate, because you're celebrating the renewal of your cells. So it's RECELLEBRATE. That's our website, recelebrate.com. It's our social media. It's everything. If you just type in Recelebrate, you should find us.
Yeah, I'll make sure that link's in the show notes as well.
Thank you.
Jeff, thank you so much for your time. I've really enjoyed picking your brains today and getting some answers to questions that I had floating around in my head. So thanks very much.
Good. Thank you for having me. It's been an honor. And I hope I've not only given you answers, but stimulated more questions.
Yeah, awesome. If I come up with more questions, I'll have to get you back on, Jeff.
Anytime.
Awesome. So that's all from Jeff and me for this week. But don't forget to join me same time, same place next week on the Radical Health Rebel podcast. Thanks for tuning in. Remember to give the show a rating and a review, and I'll see you next time.